The number of surgical procedures performed on the wrong side of the body has increased in the past few years in Minnesota. To help fight this trend, the Safe Surgery Coalition started the Time Out Safety campaign in June. Becky Parker shows us how one local hospital has implemented the program to go beyond standard practice.
A surgery performed on the wrong side of the body can have somewhat mild to severe effects on a patient. Staff at Lakewood Health Systems and Staples say they take that very seriously.
If there is a cancerous event occurring, such as affecting a kidney, and if you obviously take out the wrong kidney, that has severe repercussions for that patient.
To end surgical errors, the Minnesota Safe Surgery Coalition developed a new 5-step timeout process. Rather than having just one nurse in the operating room review the patient's name, procedure, and other important facts, a nurse, anesthesiologist, surgical technologist, and surgeon take turns verifying patient information.
Everybody that's in the OR, giving them responsibility in the timeout, puts accountability into each of their hands.
In addition, patients themselves repeat their name and procedure at each step of their visit.
It came right out of their mouth, and I can verbally, I can match that to what they signed on their consent form, and it's a good verification for me to make sure I have the right patient and I'm doing the right procedure.
Lakewood has used the timeout process for a while, but have updated their approach to include the new guidelines, along with a few extra touches.
At Lakewood, they have what they call a timeout towel. It's this bright orange towel that they lay over the surgical instruments to remind staff to perform the timeout process before surgery begins.
It's just a really big, bright reminder saying that, hey, we got to stop and we have to do the timeout before we start.
The coalition hopes increasing standards will eliminate surgical errors. Becky Parker, Lakeland News.
And Lakewood didn't have any adverse surgical events, including wrong side surgeries, in 2010.
If you've enjoyed this segment of Lakeland News, please consider making a tax-deductible contribution to Lakeland Public Television.